This talk is entitled Tools in Measuring Program and Learning Outcomes of Medical Students, a Guide in Designing a Master Blueprint. This will be part one of the Tools in Measuring Program and Learning Outcomes. There will be subsequent parts in this big topic. The subtitle of this talk is Tools in Measuring Knowledge, Skills, and Attitude of Medical Students, a Guide in Designing a Master Blueprint. Recommended prior study, assessment and evaluation of medical students, R.O. Hawson, TPORs, or thoughts, perceptions, opinions, and recommendations. Notes on the plans of R.O. Hawson, OSCIL, which stands for Online Collaborative and Interactive Learning on Medical Education, on the topic, Tools in Measuring Program and Learning Outcomes of Medical Students. This will be part one, a guide in designing a master blueprint. Subsequently, there will be part two and part three, hopefully. So there will be design and development of tools to measure students' learning and performance. Part two will be on construction of the tools, and part three will be on scoring and grading. The learning objectives for this particular talk will be the following. At the end of the session, the student must be able to identify the various types of objectives and outcomes of a medical curriculum that must be considered in order to serve as a guide to both faculty and students in teaching and learning, and in the global or overall assessment and evaluation of students' learning and performance. Define program educational objectives, program outcomes, course level learning outcomes, and session level learning objectives. Differentiate learning outcomes from learning objectives. Describe the program educational objectives expected by the Commission on Higher Education, or CHED, of a Philippine medical school. Enumerate the program outcomes required by CHED of a Philippine medical school. Describe the policies of CHED on the use of tools to assess and evaluate medical students and use of performance indicators. Reproduce the framework recommended by R.O. Hawson in the design and development of tools to measure the global or overall accomplishment of students' learning and performance in a medical school. Explain the factors to consider in the selection of tools to measure students' learning and performance vis-a-vis the various categories of objectives and outcomes in a medical curriculum. Describe the three domains of learning that may be used to guide in the selection of tools to measure students' learning and performance on the various categories of objectives and outcomes in a medical curriculum. Describe Bloom's taxonomy on cognitive domain that can be used in the selection of tools to measure students' learning and performance. Describe the Bloom's taxonomy on affective domain that can be used in the selection of tools to measure students' learning and performance. Describe Bloom's taxonomy on psychomotor domain that can be used in the selection of tools to measure students' learning and performance. Describe the three general categories of tools to measure students' learning and performance as recommended by Dr. R.O. Hawson, and give examples of specific tools. Given the domain of learning, Give an example of a tool that may be used to measure students' learning and performance. Given an action verb in a learning objective or outcome, give an example of a tool that may be used to measure students' learning and performance. And lastly, make a draft of a master blueprint of tools to be used in the entire medical school to measure global accomplishment of students' learning and performance. In the medical curriculum of a medical school, the program educational objectives, program outcomes, course level learning outcomes, and session learning objectives should be spelled out to serve as a guide to both faculty and students in teaching and learning, and in the overall assessment and evaluation of students' learning and performance. Program educational objectives are the broad statements that describe the career and professional accomplishment that the program is preparing the graduates to achieve. Case in point, the CHED 2016 guidelines for Philippine medical schools state the following program educational objectives. The main goal of the Doctor of Medicine program is to develop professional physicians for the Philippine healthcare system. The graduate of the Doctor of Medicine program is a primary care physician after passing the Philippine Licensure Examination, or PLE. Program outcomes or program learning outcomes are the broad statements that describe the competencies that the program is preparing the graduates to achieve. Case in point, the CHED 2016 guidelines for Philippine medical schools state the following program outcomes. Demonstrate clinical competence, communicate effectively, lead and manage healthcare teams, engage in research activities, collaborate with interprofessional teams, utilize system-based approach to healthcare, engage in continuing personal and professional development, adhere to ethical, professional, and legal standards, demonstrate nationalism, internationalism, and dedication to service, practice the principles of social accountability. Course level learning outcomes are specific statements of learning, performance, and attitude that students need to achieve at the end of a particular course or study. The course level learning outcomes contribute to the achievement of the program outcomes and eventually the program educational objectives. Session learning or session level learning objectives are specific statements of learning, performance, and attitude that students need to achieve after an educational activity within a course. The session level learning objectives contribute to the achievement to the course level learning outcomes. A note on learning outcomes versus learning objectives. These are terms commonly encountered in education and commonly used interchangeably. Learning outcomes describe in observable and measurable terms what the student should be able to do after completing a learning experience. Learning objectives usually describe, also in observable and measurable terms, what a faculty aims to do through organizing specific topics or individual learning activities to achieve the learning outcomes. The students may be allowed to contribute to the formulation of learning objectives of an educational session. Tools with performance indicators in measuring program and learning outcomes of medical students. So these are the CHED policies. In the curriculum of a medical school, there shall be tools with performance indicators to measure the degree of accomplishment of the students at all levels, namely program educational objectives, program outcomes, course level learning outcomes, and session level learning objectives. The performance indicators will serve as a basis for assessment and evaluation of student achievement through different points in the curriculum from start to finish. My observation, first observation, a lot of times, a lot of medical schools utilize written tests only to assess and evaluate students. There should be other tools considering there are other domains of learning to assess and evaluate, such as the affective and psychomotor domains. Written tests are generally used for cognitive domain and not for affective and psychomotor domains. Within the cognitive domain, there are also different levels of learning. We will take a look later on the Bloom's taxonomy of cognitive domain that must be assessed and evaluated and which require tools other than written tests. Second observation, the physician licensure examination evaluates graduates on a cognitive domain only, none on the affective and psychomotor domains. Ideally, not enough. However, it has been the practice since time immemorial. Here is a recommendation. My recommended framework for the design and development of tools to measure the global or overall accomplishment of the students' learning and performance. First column are listed the program educational objectives, program outcomes, course level learning outcomes, and session learning level learning objectives. On the second column, these are the elements to measure. So the elements to measure will have to be identified from these four categories. And then the third column will be on the tools to use to measure the elements. And then on the next column will be the performance indicators. And then the last column will be assessment and evaluation. The choice of what tools to use to measure will first depend on the elements to be measured. These elements should be listed down on the column under elements to measure. Then, depending on the elements to measure, one or several appropriate tools will be selected and later implemented. The factors that govern the selection of measuring tools based on the elements to measure consist of the following: type of learning domain, either cognitive, affective, or psychomotor, levels of learning in each domain in consideration of the Bloom's taxonomy, and then behavioral verbs in the learning objectives and outcomes. Other factors that govern the selection of tools will be the following: validity, reliability, and usability. I will be expounding on these factors one by one. Let's start with the types of learning domain: cognitive, affective, and psychomotor. To facilitate the selection of tools, the elements to measure can be classified into three domains of learning, namely cognitive, psychomotor, and affective, or into the three aspects of learning for competence, namely knowledge, skills, and attitude. So these are the three domains of learning relevant to medical education and medical students. Cognitive domain which is equivalent to knowing, knowledge, and mental skills. Psychomotor domain, doing, skills, manual or physical skills. And then affective domain, these are the feeling, the attitude, the growth in feelings or emotional areas. Cognitive domain, this focus on the knowledge acquisition and intellectual skills and abilities. So example will be the diagnosis of the disease and strategizing treatment options. These are all examples of the cognitive domain. Psychomotor domain, this relates to the skills that require varying levels of well-coordinated physical activity and precise manipulative procedures. The examples are doing physical examination, performing a needle aspiration, suturing of an open wound. Affective domain, this deals with the feelings, emotions, mindsets, and values, including the nurturing of desirable attitudes for personal and professional development. Examples are allaying the concerns and fears of the patients, displaying empathy for the relatives of a patient who just died, displaying mutual trust and respect in working with members of the healthcare team, upholding high ethical standards in practice. Let's now go to these levels of learning in each domain, or the Bloom's taxonomy. Under each domain of learning, there are different levels of complexity and specificity that are described and being advocated by educators. Bloom's taxonomy of learning is the most popular and widely used globally. So there is the Bloom's taxonomy of cognitive domain, affective domain, and psychomotor domain. Under each domain of learning, there are different levels of complexity and specificity as mentioned, and this should serve as a guide in the selection of measuring tools. Example, in the cognitive domain, from lowest level to the highest level, you have remembering, understanding, applying, analyzing, evaluating, and creating. And then in the affective domain, these are different levels: receiving, responding, valuing, organizing, and characterizing. And then in the psychomotor domain, from lowest to the highest level, imitating, manipulating, precising, articulating, and naturalizing. Before continuing on with the discussion of the factors that govern the selection of measuring tools, presentation of different categories of tools is in order to facilitate our discussion and presentation. So these tools can generally be categorized into test, observation or observation technique, project or project-based technique. Under each category are many more specific tools. This will be expounded in another lecture or talk, but some examples are given below just to give an idea what can fall under each general category of tools. Examples of common tests are the written test, either paper, pencil, or digital or online, and oral exams, face-to-face or tele-online. Examples of common procedures under observation are the practical exams, the objective structured clinical examination, OSCE, and observation of performance skills and attitude using checklists and rating scales, anecdotal records, and critical incident technique. Examples of projects to measure students' learning are case study and discussion, management of actual problem-solving situations, research projects, and learning and reflection portfolios, etc. Note, multiple tools may be selected or necessary to capture all or most aspects of the competency to be measured if any single method may not be sufficient to do the job. Tests are weakest on assessing, evaluating psychomotor or affective learning domains. Third note is that observation may be used to assess, evaluate multiple learning domains simultaneously at the same time: psychomotor, cognitive, and affective. And direct observation are stronger tools than indirect observation. Below is a table of tools commonly and can be used to measure students' learning and performance based on the learning domains implied in the learning objectives and outcomes. So under cognitive domain, you can have test, observation, and project. For affective domain, observation and projects. Examples will be anecdotal reports, portfolios, critical incident technique. For psychomotor domain, the tools that can be used will be observation, usually what we popularly known as practical exam. An example also will be the popular OSCE, Objective Structured Clinical Exam, and project can also be used for evaluating psychomotor domain. Note, multiple tools may be selected or necessary to capture all or most aspects of the competency if any single method may not be sufficient to do the job, and observation may be used to assess or evaluate multiple learning domains simultaneously. Direct observations are stronger tools than indirect observations. Below is a table of tools commonly and can be used to measure students' learning and performance based on the level of learning in each domain in the Bloom's taxonomy. So in the cognitive domain, you have these different levels: remembering, understanding, applying, analyzing, evaluating, creating. So examples of tools that can be used to measure each level will be tests for remembering, understanding, test and observation for applying, test, observation, projects, test, observation, and projects for analyzing and evaluating, and then projects for creating. Now for the affective domain, again, you have different level. Observation can be used for evaluating, receiving, and responding level of learning. Observation projects can be used for evaluating, valuing, organizing, and characterizing. For the psychomotor domain, observation are examples of tools that can be used to evaluate imitating and manipulating level of learning. And then observation and project can be used for evaluating, precising, articulating, and naturalizing. The next will be the next factors that will be presented, will be discussed, will be the behavioral verbs in the learning objectives and outcomes. Behavioral verbs in the learning objectives and outcomes should also serve as a guide in the selection of measuring tools. So the advice is to use behavioral verbs to come out with behavioral objectives. Behavioral objectives describe what the students will be able to do after a learning activity, something that is observable and measurable. And each objective should begin with a verb that describes an observable behavior such as describe, summarize, demonstrate, compare, plan, and score. One can observe the student and or measure how well the objective was met. So below is a table of tools commonly and can be used to measure students' learning and performance based on the behavioral verbs in the learning outcomes and objectives. So here, for the action verb define and discuss and explain, one can use test, either written or oral. And for the discuss and explain, you can use the essay or oral exam. For apply and evaluate, one can use tests, observation, and projects. For the level of creating, we can use the project and then demonstrate a medical procedure skill. Observation will be the best tool to use. Demonstrate professionalism in patient care. Again, observation, either direct or indirect. Examples would be the use of portfolio, critical incident technique, anecdotal reports. And then to demonstrate oral communication skills, the best will be to use observation. Demonstrate a behavior or attitude. Again, observation, either direct or indirect. And then for an action, verb, or behavioral objectives stating that the student must be able to critique a paper, the best tool to use will be the project-based technique. Note again, multiple tools may be selected or may be necessary to capture all and most aspect of a competency if any single method may not be sufficient to do the job. And observation may be used to assess, evaluate multiple learning domains simultaneously. Okay. And direct observation, again, are stronger tools than indirect observations. The other factors that govern the selection of tools are the following: validity, reliability, and usability. The specific tools chosen for the elements to measure must be appropriate or valid, reliable, and usable or practical. So we define validity as the appropriateness, adequacy, accuracy, and effectiveness of the measuring tools, meaning they measure what they are designed to measure. So examples of non-validity will be using a tool that measures a medical student's technical proficiency will not be valid for predicting bedside manners. So example of a tool here would be a written test will not be valid for predicting a bedside manner. Okay? And then another example of non-validity is using written tests to assess or evaluate a medical student's skills, okay, will not be valid. Reliability refers to the consistency of measuring tools in producing results. Consistent results mean that the students being assessed and evaluated get the same score or grade no matter how, where, and when they are subjected to the measuring tools. Put in another way, if similar scores are obtained when the same measuring tool is used on the same students at different occasions, it can be concluded that the results have high degree of reliability from one occasion to another. Similarly, if different faculty mark students' answer on the same measuring tools and obtain quite similar results, it can also be concluded that the results have a high degree of reliability. Usability refers to the practicality of the measuring tools. It should be economical in terms of time and money, easily administered and scored, and produce results that can be interpreted and applied by the medical school. Summary of what have been presented in relation to this topic. Okay. Tools in measuring program and learning outcomes, or measuring knowledge, skills, and attitudes of medical students, a guide in designing a master blueprint. I presented this framework, okay, for the design and development of tools to measure the global, the overall. That's why it includes these 4 educational objectives: program outcomes, and then the course level learning outcomes, session level learning outcomes. Then elements to measure. Analyze the statements on the program and learning objectives and outcomes. Identify the domains of learning: cognitive, psychomotor, and affective. Identify the levels of learning using the Bloom's taxonomy, and then identify the behavioral verbs used in all this, in the statements of all these things. The factors that govern the selection of measuring tools based on the elements to measure consist of the following: type of learning domain, the level of learning in its domain, behavioral verbs, and the other factors will be the following: validity, reliability, and usability. For the tools to use to measure, three general categories of tools to select from. You have the test, observation, and projects. Select one or a combination of tools which are valid, reliable, and usable for a particular program or learning objective or outcome. Performance indicators decide on pass, fail, satisfactory, unsatisfactory, needs improvement. For assessment and evaluation, decide whether and which tools will be used for formative assessment or summative assessment, or the so-called evaluation. Now, for enhancement of learning and for development of the medical school, I'd like to give an assignment, which is to make a master blueprint of tools in measuring program and learning outcomes of medical students, as this will form part of the quality management system of the school. So the assignment will be like this: make a draft of a master blueprint of tools to be used in the entire medical school to measure global accomplishment of students' learning and performance. I suggest that you utilize the framework that I recommend in the design and development of tools to measure the global or overall accomplishment of students' learning and performance in the medical schools, as shown. And then for the program educational objectives and program outcomes, use those mentioned in CHED 2016 guidelines for medical school. For the course level learning outcomes, use a course one is presently handling, specify the name of the course. For the session level learning objectives, use a session of learning one is presently handling or has handled, specify the name and title of the learning sessions, then place the name of the medical school, place the name of the faculty accomplishing this assignment. So the target will be to synthesize and integrate all inputs of several faculty, or all the faculty as much as possible, to become the master blueprint for the entire medical school, if there is no existing one right now. So the title can be like this: Tools in Measuring Program and Learning Outcomes of Medical Students, a Master Blueprint under a particular medical school, your medical school. So I will now help start the ball rolling by giving inputs on the program educational objectives and program outcomes, and some guidelines on the learning outcomes and learning objectives. So a sample is seen here: program educational objectives, elements to measure. So as stated in the CHED's guideline, to develop professional primary care physicians for the Philippine healthcare system. So the assumption here is that there is a medical curriculum designed and developed towards this objective. Tools to use to measure: all the measuring tools, the tests, observation, and projects planned out or included in all the courses of the curriculum. So we have to have the master blueprint of all the measuring tools. And then under performance indicators, the passing grades in all the courses in the medical curriculum should be indicated. And then for assessment and evaluation, indicate whether it's formative or summative evaluation, okay, whether it's pass or fail. The other element to measure under program educational objective will be to qualify for the Philippine licensure examination, The assumption here is graduating from a CHED-approved medical curriculum school qualifies one to take the PLE. Under tools to use to measure, all the measuring tools, tests, observations, projects, planned out or included in all the courses of the curriculum. Again, we have to look at the master blueprint. Now, performance indicators, passing grades in all the courses in the medical curriculum, and then assessment, either formative and or summative, pass or fail. The last element to measure in the program educational objectives is to enable graduates to pass the Philippine licensure examination. The assumption here is graduating from a CHED-approved medical curriculum should automatically enable one to pass the PLE. However, the contents of the PLE may not be completely covered in the medical curriculum or school. Also, there may be differences between PLE examiners and faculty in answering questions in PLE. So tools to use to measure: written examinations, pattern after PLE, multiple choice questions, 4 options, and inclusion of common questions in PLE. So the school will have a collection of common PLE questions to enable graduates to pass the Philippine licensure examination. So performance indicators will be to indicate the passing grade, and then assessment and evaluation, whether it's formative or summative, pass or fail. Now, as to the program outcomes, so listed here are the program outcomes required by CHED or indicated by CHED. Okay. So all of them will have performance indicators of satisfactory and unsatisfactory. Then there should be indications of whether it's formative or summative when it comes to the time that the tools are being used to measure, okay, either pass or fail. Okay. The other program objectives, similar entries on the table. Okay. Okay. Now let's go to the elements to measure, okay, and also the tools to use to measure. So demonstrate clinical competence. The operational definition of the program will be to completely manage clinical conditions of all patients in various settings. So test tools to use will be combination of test, observation, and project. Or to communicate effectively, observation can be used. Okay. There are 1 asterisk here, and in other entries there will be 2 asterisks. But so as a notation, okay, those with 1 asterisk are more of the learning in the psychomotor domain, just like this one: demonstrate clinical competence, communicate effectively. Whereas those with 2 domains, as I shall present them later on, are more on the affective domain of learning. And then another note here will be combination of tools are recommended to be used for this type of for these program outcomes. Lead and manage healthcare team, another program outcome. So observation and project will be the tools to use to measure, and then engage in research activities, observation, and project. Collaborate within interprofessional teams, and then utilize system-based approach to healthcare. Okay, it will be a combination of observation and projects for this one, and then combination of test, observation, and projects for utilizing system-based approach to healthcare. So here are program of outcomes with 2 asterisks. Okay, so these are more on the affective domain of learning. Okay. So engage in continuing personal and professional development. The operational definition here would be to update oneself through a variety of avenues for personal and professional growth to ensure quality healthcare and safety. So the test to be used here will be observation and project. And observation project is also recommended for this particular program domain to adhere to ethical, professional, and legal standards. For the last two program outcomes, demonstrate nationalism, internationalism, dedication to service, and practice the principles of social accountability. So the recommended, the tools to be used will be observation and projects. Okay, and observation and projects also for this one. Now for the course level learning outcomes and course level session level learning objectives, okay, so we just have to divide it, categorize it into cognitive domain, okay, and then affective domain and psychomotor domain. And then the general policy here will be on the tools to use to measure. So we may have several options, but we choose one or combination that are most appropriate, guided by the behavioral verbs used. Performance indicators will be pass or fail for the three domains, and then assessment either formative or summative. Okay. So I'd like to summarize by presenting the learning objectives again. Okay. I hope we have learned all of this. Okay. Number one, identify the various types of objectives and outcomes of a medical curriculum, okay, that must be considered in order to serve as a guide to both faculty and students in teaching, learning, and in the global or overall assessment and evaluation of students' learning and performance. And we say that these various types of objectives and outcomes are the following: program educational objectives, program outcomes, course level learning outcomes, and session level learning objectives. Okay. So we have defined all of this, and then we also have differentiate the learning outcomes from learning objectives. We have described the program educational objectives expected by CHED, and also we have enumerated the program outcomes required by CHED for a Philippine medical school, the policies of CHED on the use of tools to assess, and they want it global overall, not just the course or session learning activity or learning objectives. Okay. And there must be performance indicators for all these tools. And then I have presented a framework which I would recommend that you use in the design and development of tools to measure the global accomplishment of students' learning and performance in the medical school. Then we have explained the factors to consider in the selection. Okay. We described the three domains of learning. Then the Bloom's taxonomy on cognitive domain, affective domain, psychomotor domain, and then the three general categories of tools to measure the students' learning and performance as recommended by yours truly, okay, which are test, observation, and projects. And given a domain of learning, give an example of a tool that may be used to measure students' learning and outcome. I have given you samples of that. Given an action verb in a learning objective or outcome, give an example of a tool that may be used to measure students' learning and performance. Again, I have given examples on that. And lastly, make a draft of a master blueprint of tools to use in the entire medical school to measure global accomplishment of students' learning and outcome. Okay. So this will come in the form of an assignment, which I hope you will accomplish in due time. So with that, I end my talk. Thank you for your kind attention. I wish you all the best.